However, a dire warning tonight from one of North Idaho's top pediatricians saying that unless school districts or other local leaders in the Panhandle make some big changes, kids there going back to school are at serious risk of not only catching COVID, but getting hospitalized because of it. And making matters worse, there simply are not enough beds or medical staff to properly treat them. Our Casey Decker spoke with Dr. Vanessa Carroll tonight. And Casey, let's start off with, what did she tell you?
Yeah, Whitney, Dr. Carroll is the director of medical pediatrics at Kootenai Health, and she says data from other districts in the country tells us a frightening story, that even though kids mostly did okay with previous variants of the coronavirus, this Delta variant is different. A significant portion of kids are not eligible for that vaccine, and of those who are eligible, less than 40% in North Idaho are actually vaccinated. That leaves thousands of kids vulnerable. And based on the current data, Dr. Carroll says 200 or more children could end up in the hospital with COVID just from the Coeur d'Alene School District alone. About 60 of them, she thinks, would need to go to the pediatric ICU. But Kootenai Health doesn't have a pediatric ICU, and other hospitals in the region are extremely limited with both space and staffing.
The current information is about a third of these kids that are managing to get admitted need an intensive care bed space, and they need that higher level. Gosh forbid, they might even need mechanical ventilation to keep their lungs, expanding and breathing, because these are some rough viruses. With that in mind, you then look around the region and there's just not 60 beds to care for even our school district, much less our surrounding neighbors. So it's a real problem.
Does that mean there could be a scenario where doctors are having to triage children in a sense and decide who gets a ventilator and who doesn't?
You're absolutely right. And that's our worst nightmare. And that's why our team is preparing so rigorously, because we don't have a pediatric intensive care unit, but we recognize when someone's child is struggling and you need to step in, there's a great chance that our team is going to have to then intubate and ventilate a child without a PICU, and then be able to hopefully transfer them to another facility that does. And there are some, but we just talked about there's not enough beds.
And the thing is here, that nightmare scenario is preventable. It can be prevented with the vaccine in those who are eligible, and the threat can significantly be mitigated by wearing masks and social distancing, ventilation, hand washing, staying home when sick, all also important tools. The thing is, North Idaho school districts are essentially doing none of those things. That's why Dr. Carroll says that even though she understands people are tired of protocols, it's time for local leaders to step up here. She and dozens of other experts sent a letter to the school board calling on them to issue new policies to protect kids and prevent that nightmare scenario. Whitney, Tom?